delighted to be speaking with you today, but it would be really good for us to be able to tell the others in the organisation a wee bit about yourself and where you come from. So over to you.
Yeah, well, equally, Dale, it's lovely to be here and lovely to be talking to you today. I actually hail from Wairarapa. I'm born in Masterton, and I did my secondary schooling in the Lower Hutt, in St. Pat Silverstream. At St. Pat Silverstream because I lived with my aunt for a few years during my teen years. So I'm familiar with this area.
We're just delighted to have you. And look, what would be really nice to know, so now that you're here, what are you going to be doing for us and for what's more importantly for Māori and equity across our District Health Board?
Yes, well, I was really excited to get the role and be successful. And the role is a po tikanga. And a po tikanga is someone who holds up the tikanga of a house. And the house being Hutt Valley DHB. Tikanga simply is the way we do things. And in this aspect and in my role, it's really around, like you've said, Māori health and our responsiveness to Māori health. So part of that is everything from the shop floor, which is training with staff and meeting with staff. And actually today I met with a surgeon who wanted a short speech before he went to a conference. So we did that as well, and we did a short speech in Māori for him. But it's everything from that right through to looking at our policies and how we work in the hospital and in the community. Yeah.
Oh, look, that's fantastic. Look, I know that our Māori health team have developed a very fine Māori health strategy, and part of that is about making sure that our staff actually look forward to having Māori patients as part of the greater health service that we provide. We also provide services out to the community, NGOs, primary health care. So just in terms of having a very able, competent workforce that interacts well and actually supports the journey of young and older Māori and adults, how do you see that training coming about?
Well, I think for many years, I think you've been in the health sector a few years, and I've been around a few years as well. We did Treaty of Waitangi training. It went out of fashion for a while, and I think it's come back in vogue. So that's one part of the training. I'd say there's three parts in my view. One is Treaty of Waitangi training, and that's just the base training. It's really about the history of the treaty, right up through to what does that mean for me now as a nurse up in Ward 3. So everything from there. The other one is cultural safety. Cultural safety training really is, we drill down a bit further, and so it's not so broad as treaty training, but it's more about how do I discharge my role, how do I work with Māori and whānau and families in the hospital and in the community in the best ways possible to get the best health outcome for them. The third part of the training we're working on, and that will be looking at unconscious bias. What are my biases? What do I bring to the table when I'm working with my patients and clients? And so just understanding that, we want to raise awareness around that so that we all understand where we come from when we're working with the community.
That sounds a very fine start. So from an organisational point of view, and say from someone like the Chief Executive and the executive team, how can we support you and the whole of the Māori health team to be really successful? What would you like from us and from the rest of the staff?
One of the best ways that the senior management can support this to happen is to ensure that the messaging is put out to all their staff and put out in a positive way. So that staff, I'm going to try and make the training as fun and as interesting as possible. That's my part of the bargain, and their part, I hope, is to promote it in a positive light. The second part to that is, as you've mentioned, we have the Māori Health Strategy, where the leaders, senior leadership, can take up part of that challenge and work alongside the Māori Health team to invest and work alongside us to ensure that we're working in partnership.
That sounds fantastic to me. I like that we partnership. It's one of our core values.
I see
And so for me, this is probably one of the most important parts about equity we need to be working on. So look, Daniel, welcome to the organisation. Thank you so much for talking with me today. And I really look forward to working with you, particularly if it's going to be a fun, enjoyable journey.
Exactly. Thank you very much. Cheers, Dale.